Hi, good afternoon, everyone. Today we will explore the tiny yet powerful fungus holds the secret that could influence one of our most crucial glands, which is the thyroid. We will look at how this Ganoderma and its connection to thyroid disorder. Next. Oh, Thyroid is a small gland located below the skin and muscle at the front of the neck. So just at the spot where a bow tie would rest. Yeah. So it is brownish red with two lobes on either side, of the windpipe trachea, and they are connected by a narrow band of tissue known as the isthmus. So it is shaped like a butterfly and usually weighs less than an ounce. So the thyroid is a gland that is a part and parcel of the endocrine system, which is a collection of glands that produce all important hormones responsible for metabolism, growth, sexual function, sleep, and mood. Yeah. Yeah. Next, we'll look at the thyroid system. Yeah. So the thyroid system is a complex network involving the thyroid gland, then the pituitary gland, and the uh, hypothalamus. So pituitary gland and hypothalamus is a part of the brain at the brain area. Okay, so they are separated. So this uh, consists of the whole system. The system plays a crucial role in regulating metabolism and maintaining overall physiological balance. Here's an overview of how the thyroid system works. Hypothalamus is the master regulator. It will first trigger a hormone called TRH, thyroid releasing hormone, and send it to pituitary gland. So this pituitary gland is just located below the hypothalamus. Yeah. So pituitary gland, after receiving the order, would then create another hormone called THS. So this thyroid stimulating hormone. So they will send it to thyroid gland. So thyroid gland, once it receives this signal, it will actually start to produce the thyroid hormone T3 and T4. Okay. So in order to release these thyroid hormones, they will need the help of iodine. So we and iodine is the thing that we get it from food. Yeah, the food that we eat. So nothing is that there is a feedback system that hypothalamus will monitor the amount of T3 and T4 in the bloodstream in our body. So this is how it regulates the thyroid hormone in our body. So if they detected it's too low, they will actually trigger the signal. Okay, they will monitor and regulate and trigger the signal to produce more. If it's too much, they will actually stop producing. They will actually regulate it. So hypothalamus in the brain is the master regulator. Yeah. Next, we will look at what does thyroid hormone do. Yeah. So thyroid gland plays a vital role in regulating various physiological function in the body. So the primary function of the thyroid include, breathing. Okay, they play a key role in controlling how quickly the body uses energy and affecting processes such as calorie burning, heat producing, and oxygen consumption. Okay. Next is a heart rate. They actually thyroid hormone influence the cardiovascular system by regulating the heart rate and blood pressure. So they help maintain the balance between oxygen supply and demand in various tissue. Yeah. So thyroid hormone also play a crucial role in the development of a nervous system and the growth of bone and tissue, particularly during infancy. Very important is particularly during the infancy and childhood, okay, for development. And they also play a key role in controlling in calorie burning. Yeah. So thyroid hormone are involved in synthesis of a protein, which are essential, okay, for the muscle strength, okay, for growth, development, and repair of muscle tissue in the body. Yeah. And thyroid hormone are involved in the regulation of the menstrual cycle in women. Yeah. Thyroid disorder can sometimes affect menstrual regularity and the fertility. Yeah. And they also influence the body sensitivity to other hormone, including adrenaline. So this can affect how the body respond to changes in temperature. So helping to regulate our body temperature. Yeah. And they also impact, okay, cholesterol level in the blood. And imbalance of thyroid function, okay, in the function may lead to actually changes in lipid metabolism. Yeah. So it is important to know that maintaining a proper balance of thyroid hormones is crucial for our overall health. Okay, too much or too little of this hormone, thyroid hormone, okay, production can actually lead to various health issues. Okay, next. So next, we would like to understand the different type of thyroid disorder. So the thyroid, a small butterfly-shaped gland in the neck, plays a crucial role in regulating metabolism and overall body function. So different type of thyroid disorder can arise, each presenting unique challenges. Okay, here is a breakdown. Okay, first one is a hypothyroidism. So hypo, the word is that they actually produce less, we have less thyroid hormone in the body. So in this condition, the thyroid gland produces an insufficient amount of thyroid hormone. So this deficiency can actually lead to a slowdown in bodily function, okay, resulting in symptoms like fatigue, weight gain, and sensitivity to cold. So Hashimoto's thyroiditis can an autoimmune condition is a common cause of hypothyroidism. Yeah. So this immune system, because of autoimmune problem condition, that actually cause the immune system to create antibody that attack the thyroid cell as if they were bacteria, virus, okay, or some other foreign body, so that you may attack the thyroid gland to produce less of this hormone. Next, look at the hypothyroidism. So this disorder describes that they are producing too much. This condition is that they are excessive production of thyroid hormones. So individuals with with this hypothyroidism may experience symptoms such as nervousness, weight loss. Later we'll talk about all these symptoms, and they also affect their increased sensitivity to heat. So the grave disease is also an autoimmune condition, but is frequently caused of this hyperthyroidism. Later we'll talk more about this autoimmune condition. Next is a goiter. So this goiter is actually characterized by the so-called enlargement or swelling of the thyroid gland, yeah, enlargement. So this can occur in both hyperthyroidism and hypothyroidism. It may be a result of various conditions, yeah, including iodine deficiency, autoimmune disorder, and abnormal thyroid function. Yeah. So thyroid nodule. Okay. Next is the thyroid nodule. Nodule are abnormal masses of lumps that can develop in the thyroid. gland. So while the majority are benign, benign means non-cancerous, okay, caused by cysts or non-cancerous tumor. It's a tumor, okay, but it's benign, means it's non-cancerous. So some nodule may be, but some nodule may be cancerous, okay. So if it's cancerous, it's a malignant, yeah. So thyroid nodules are often discovered during the routine examination, okay, through a routine normal health check. It may require further evaluation to determine their so-called appropriate management. The last one is the last disorder is the thyroid cancer. So this thyroid cancer involve the, as we know that cancer cell is an uncontrolled growth of cell in the thyroid gland. So it can manifest as a lump or nodule in the neck, okay? While most thyroid nodules are benign, which is non-cancerous, but a small percentage can become cancerous, yeah? So thyroid cancer is often treatable, especially when detected early. So understanding this type of thyroid disorder are crucial for early detection. So accurate diagnosis and appropriate management. Yeah. So regular checkup and thyroid function tests are essential for maintaining thyroid health and addressing any potential concern earlier. Yeah. Next. Next, we will look at statistic. Yeah. So did you know that globally, around 200 million people deal with thyroid disorders, with women being 10 to 15 times more likely to be affected? Because why? Because of hormone change, because estrogen hormone and all this. So for pregnant women, hypothyroidism can increase the risk of miscarriage. So affecting about 2% of pregnancy. Hypo means they have less thyroid hormone in the body. So for every 8 women, one will encounter a thyroid disorder in her lifetime. So even newborns aren't immune, okay, with 1 in 4,000 born with thyroid issue, yeah, sorry. Closer to home in Singapore, up to 10% of the population is having this thyroid. They are having this thyroid condition. This brings us the global and local importance of thyroid awareness. Yeah. So in summary, thyroid health is crucial, especially for women. It's very important to stay informed and monitor health regularly and seek timely medical support. Yeah. Next. Okay, now we'll look at the symptoms, complication, and causes of hypothyroidism. Yeah. So for the symptom, okay, fatigue. The patient will show fatigue. Okay, individual may experience persistent tiredness and lack of energy. Yeah. So increased sensitivity to cold, muscle weakness, ache, depression, impaired memory, constipation, hoarseness. Okay, hoarseness is a change in the voice. Okay, so increased cholesterol level. So hypothyroidism may contribute to elevate the cholesterol level in our body. So heavier and irregular menstrual cycle, just like I mentioned, that it affect them. For women, they will affect the menstrual cycle. So it will cause, okay, you will have some symptom of slow heart rate and then goiter. So goiter, just now we mentioned about enlargement of the thyroid gland. Okay, why? Because it's due to constant stimulation of release more hormone, but the hormone stay in the neck. They are not releasing out from the thyroid gland. That's why it become bigger and bigger. It become from a lump. Yeah. So dry skin may have this symptom and weight gain. So despite normal eating, individual may actually experience unexplained weight gain. Yeah. So the next symptom will be puffy face, thinning of hair. As for the complication, That's how I mentioned complication. These are the symptoms and complication. Goiter is a complication that is constant stimulation of thyroid. So it becomes bigger and bigger. So it enlarged. And this enlargement, okay, because of the hormone is not actually releasing out of the so-called, it could be one of the factors that not releasing out, okay, from the neck area. And they have heart problem. So, and then nerve damage will affect the nerve complication, their infertility. So hypothyroidism may contribute to fertility issue. Yeah, mental health issue, depression and other mental health concerning may arise. So what are the causes? The cause, it could be one of the following: autoimmune disease, yeah, especially for those that related to Hashimoto thyroiditis. So this immune system attack the thyroid gland, leading to reduced hormones production. So they produce less because of autoimmune disease. Yeah. So the other one is over response of a hypothyroidism treatment. So there's some treatment. Okay, excessive treatment of this hyper means there are treatment. The medication for this hypothyroidism can actually result in hypothyroidism. So there are two sides of the issue. So thyroid surgery. So removal of the thyroid gland can actually lead to hypothyroidism. Radiation therapy, medication, certain medication can interfere with thyroid function. Yeah. Or the other one could be pituitary disorder. So pituitary, as you know, that they have to release the hormone to thyroid gland. So if it pituitary, there's a disorder, malfunction of the pituitary gland can actually impact the thyroid hormone regulation also. Yeah. So pregnancy, yeah, hormone change during pregnancy may trigger hypothyroidism. The last one is iodine deficiency. Iodine is important, okay, for them for releasing the thyroid hormone from the thyroid gland. Yeah, so it's an essential component for thyroid hormone production also. So understanding all this aspect of thyroidism, hypothyroidism is crucial for early detection. So proper management and improved well-being for individual affected by thyroid disorder. Yeah. Next. Okay, next we will look at the symptom, complication, and causes for hyperthyroidism. Hyper, okay, which is producing too much of the thyroid hormone in the body. So the symptom may experience, okay, overactive thyroid hormone can lead to heightened nervousness and increased sensitivity to heat. So these are nervousness and increased sensitivity to heat. So this one is symptom. And fatigue, muscle weakness. The other symptom could be rapid and irregular heartbeat, palpitation and tremor. So individual may feel palpitation, awareness, they experience tremor or shaky hand. Yeah, sweating and changes in the menstrual pattern. Yeah, frequent bowel movement and goiter. Yeah, goiter is the enlargement. Yeah, in the neck area. So difficulty sleeping, and also may have symptom of weight loss and increased appetite. So despite increasing appetite, weight loss may occur due to because of what? Because due to accelerated metabolism. Yeah. So this is another symptom could be skin thinning and brittle hair. Yeah. So for complication, okay, complication, you have heart problem. You will have heart problem. Hyperthyroidism can strain the cardiovascular system, leading to a heart-related complication. An eye problem, okay, especially in the case of the grave disease. So this grave disease is a common cause of a hyperthyroidism. It can affect the eyes, causing bulging, okay, bulging, and redness and visual change. Brittle bone complication on that, and red swelling skin, and thyrotoxic crisis. Okay, so this is a severe and life-threatening condition with symptoms like fever, rapid pulse, and delirium. Okay, delirium is a mental state in which you are confused at the time, disoriented, and not able to think or remember clearly. So it usually start suddenly, okay, and it's also often temporary. Yeah. So these are the complications. As the causes, okay, the first one is autoimmune disease. So Graves' disease is the one that caused by autoimmune. Then the immune system mistakenly attack. Okay, now this one is attack the thyroid gland. Okay, and leading to excessive production of thyroid hormone. Okay, they mistaken. Okay, so this immune system cause all this. So it's an autoimmune disease related. Next is the hyperfunctioning of thyroid nodule. So this nodule produce excessive thyroid hormone, okay, causing hyperthyroidism. So types include toxic, also so-called this disease. And the other one is inflammation. So inflammation of the thyroid. So either due to an infection or an autoimmune reaction. Yeah. So understanding this intricacy of hyperthyroidism is crucial for early detection. Yeah. So next. Next is the so-called, we'll look at the symptom complication. This one now we'll look at the goiters. Yeah. So so the symptom is, as we just mentioned, about the swelling, okay, the enlargement at the base of the neck, so in the neck area. And the symptom, this is one of the symptoms. Yeah. So it's particularly very noticeable. Okay. So the other one symptom, you may feel tight feeling in the throat, coughing, hoarseness. Yeah. So your voice change and difficulty in swallowing. Okay. Difficulty in breathing. Okay. Next is the complication. So the complication will be the small goiter that are not physically or cosmetically problematic. So it's not so big. So are generally not a concern. Okay. But large goiter can lead to difficulty in breathing and swallowing. So as well as coughing and the voice change. Okay. So the causes, one of the causes, the following are the causes: iodine deficiency. Okay, insufficient iodine in the diet. So iodine is that we actually get it from food. So iodine is important because if without iodine, the thyroid hormone will stay in the thyroid gland. It will never move out. So we need iodine to move them out. Yeah. So if it's less iodine, of course, the thing will keep growing. But your body will, the so-called the master regulator will keep saying that, hey, I don't have enough so-called thyroid hormone. But in fact, you are producing a lot, but it stay in your thyroid gland. That's why you have this goiter stay there and become bigger and bigger. And this is one of the causes. The other one is autoimmune condition. So immune condition, there are two. Okay, autoimmune. They have Graves' disease and Hashimoto. So Graves' disease is because of overactive, meaning overactive thyroid. Okay, leading to this goiter. It could be overactive means the hyper. So Hashimoto disease, underactive thyroid. Okay, is too not enough the thyroid hormone. So these are the two autoimmune conditions. The other one is a structural issue. Yeah. So it could be multi-nodular goiter, meaning you have enlarged thyroid with multiple nodules, means they have a small, but there are many. Yeah. And solitary thyroid nodule, it's a single nodule in a thyroid. So the other one is a thyroid cancer. So this one is uncontrolled cell growth in the thyroid. And the last one is inflammation. Yeah, you have inflammation, swelling, and chronic inflammation. So understanding this aspect of goiter is crucial for early detection, as mentioned before. Yeah, and appropriate management. So next. So next is the looking at symptom, complication, and causes for thyroid nodule. Yeah. So the symptom is often unasymptomatic. Okay, meaning most of thyroid nodule do not exhibit sign or symptom, so it remain unnoticed. Okay, you don't know. Okay, and palpable and visual swelling. So meaning that some nodule can be felt or seen as swelling at the base of the neck when it started to grow bigger and bigger. And you may feel some pressure effect. Okay, larger nodule may actually press on the windpipe or esophagus, so leading to a shortness of breath or difficulty swallowing. And the other one will be excessive thyroxine. Thyroxine is also called T4. It's T4, okay, production. So excessive thyroxine production, so which means it's T4. So certain nodule can produce additional thyroxine, causing hyperthyroidism. Okay, in fact, the thyroid hormone, okay, in general, there are T3 and T4, right? The thyroid gland produce 10% in T3 and 90% in T4. Why? Because when you release out of the body, the actual usage is on T3. So T4 will eventually actually converted to T3. That's why we produce more T4. But in this case, they are producing too much T4. Yeah, thyroxine. Yeah. So complication. What are the complications? Swallowing or breathing issue. Okay, you will have hyperthyroidism. Okay, hyperthyroidism, overactive nodule can lead to excessive thyroid hormone production. Okay, so post-surgery complication. So individual may experience challenge related to thyroid nodule after they did the surgery. Okay, often require thyroid hormone replacement therapy. After, yeah. So the causes is that following are the causes: overgrowth of normal thyroid tissue, thyroid cysts, multinodule goiter, okay, thyroid cancer, chronic inflammation, and the iodine deficiency. Yeah. Next. Next, we'll look at the thyroid cancer, okay, for their symptom, complication, and causes. Symptom is that obviously there's a lump, yeah, and the voice change, and difficulty in swallowing, and the neck and throat pain, okay. So also you have a swollen lymph node. So these are the symptoms. Complication is that recurrent they will reoccur recurrence again despite treatment. So even after the removal of thyroid, okay, microscopic cancer cell may spread beyond the thyroid, leading to a possibility of recurrence. Yeah. So the causes, the exact causes of thyroid cancer is not well known. Okay, understood. So it could be inherited gene mutation. Yeah. So in some cases, a genetic so-called factor related, okay, to mutation may actually contribute to the development of thyroid cancer. Yeah. Next. Next, we'll look at the causes of this thyroid disorder. Yeah. So first one is iodine deficiency. So we just now talk about inadequate intake of iodine is a crucial component for thyroid hormone synthesis. So can disrupt the normal function of the thyroid gland, so leading to a various disorder. Iodine, we actually get it from food, such as egg, dairy, seafood, and some from plants. Yeah, so we need all this to actually make hormone, make the thyroid hormone. Next is the autoimmune diseases. So autoimmune diseases, they have Graves' disease, they have Hashimoto. Graves' disease is related to hypothyroidism, and Hashimoto is related to hypothyroidism. Next, is the inflammation. So inflammation of the thyroid caused by viral or bacterial infection. So it actually impacts their function. Yeah. So next is the nodule. So this nodule referring to non-cancerous lump. Yeah. So abnormal growth of or nodule can actually develop in the thyroid. So while most are non-cancerous, but they can affect the thyroid function, leading to a various disorder that we mentioned just now. And cancerous tumors. So cancerous tumors are those malignant growth in the thyroid. Okay, it grow and uncontrolled and can result in thyroid cancer. So the early detection and treatment are crucial for this managing this condition. The other one is medical treatment. So certain medical intervention, including radiation therapy, thyroid surgery, and specific medication can actually impact thyroid function also, and contribute to the development of thyroid disorder. Yeah. The last one is a genetic disorder. Some individual may inherit genetic factor that actually cause the thyroid disorder. So all in all, in summary, understanding these diverse causes is essential for accurate diagnosis and tailored treatment approach. So whether influenced by environmental factor, autoimmune processes diseases, or genetic factor, thyroid disorder require individual management strategy to restore thyroid function and maintain overall health. So important to have a regular monitoring and collaboration with a healthcare professional like a doctor play a key role in effective management. Yeah. Next. So next we'll talk about the diagnosis of this thyroid disorder. The first one is a blood test. So blood test. So the higher THS is just now we're talking about the thyroid hormone level. So they based on this THS. So this is THS, higher THS, meaning is for hypothyroid, and lower THS is for hyperthyroidism. So how it works is that when you actually do a test, when your THS is high, meaning your body is in a didn't produce, they detected that you don't have the so-called enough sufficient of thyroid hormone. That's why your THS is high. They keep produce. They need to produce more. That's why, because your body is low in so-called thyroid hormone. So that's why it works the other way. If your THS is low, they detected in blood test is low, meaning you're hyper, meaning because of your body already show you have a lot of thyroid function. That's why it actually produce low. They need a low THS. Yeah, this is how they detect in the blood test. Yeah. So next is the iodine uptake test. So this is to test how much the iodine being absorbed by the thyroid gland. So because iodine is needed to make and release the T3, T4 from thyroid gland, so you can tell how much hormone the gland is making. Yeah. How it works is that how they actually do a test is that they have a device to measure, okay, background radioactive that actually placed over your neck, okay, and then let you swallow a small amount of the radioactive iodine and measure, okay, and measure again after 4 to 6 hours. So when the gland has a lot of iodine, radioactive will actually uptake the scan and will be connected. So iodine collecting in nodules suggests that they are responsible for the extra hormone. Yeah. So they know that based on this, they know that the amount of so-called thyroid hormone that you have in your thyroid gland. The last one is very obvious, is that they actually do a physical check. Yeah. So all ultrasound biopsies thyroid for thyroid cancer, they suspect thyroid cancer, they'll do a biopsy. Yeah. Okay. Next here, we'll look at the treatment option for thyroid disorder. Yeah. So for the thyroiditis means inflammation. So we'll use the so-called the anti-inflammation drug. So they will have this so-called aspirin or acetaminophen, acetaminophen, okay, or aspirin, okay, they will use for the pain relief. So in case of the inflammation, short-term use, okay, in cases of the so-called inflammation, they will actually short-term use prednisone, maybe subscribe to the anti-inflammatory effect. So for this hyperthyroidism, meaning your body have a lot of thyroid so-called hormone, they will use the radioactive iodine treatment, okay, and anti-thyroid medication. Yeah. So drug like the metamazole, okay, may be described by a doctor to reduce the production of thyroid hormone. Next is a surgery. Another treatment is a surgery for hyperthyroidism. So surgery is they do a surgical removal of a portion of the thyroid gland, or okay, or whole may be considered, in depend on the cases. Yeah. So for hypothyroidism, the treatment will be thyroid hormone replacement. So they will use a medication called levothyroxine. Yeah, so this is a common treatment, involve daily supplementation with levothyroxine. So it's a synthetic form of the thyroid hormone T4. Yeah, so this help to restore, because it's low, hypo is low. So they actually supplement with this so-called hormone replacement by using this synthetic type of drug. So this help to restore the normal thyroid hormone level in your body. The last one is a thyroid cancer. Okay, for thyroid cancer, it's a surgery. Yeah. So they were the primary treatment is to involve surgical removal of either the cancerous tissue or the entire thyroid gland. So it depends on the extent and the type of cancer. Yeah. So individual treatment plan are determined based on the type of severity of the thyroid disorder, as well as individual patient, their factor. So regular monitoring and adjustment to treatment may be necessary to ensure the optimum thyroid function and overall well-being. Yeah. So next. Okay. Now we look at in TCM perspective and its approach. Okay. So in TCM perspective and approach is to balance the function of the thyroid gland. So we will explore the connection between the emotional stress and hyperthyroidism. Yeah. As well as how TCM view this imbalance and provide holistic solution. Okay. So let's start by diving into a small root cause of hypothyroidism. According to TCM, do you know that the emotional stress play a significant role in disrupting the balance of our thyroid gland? So liver qi stagnation. Okay, TCM suggests that emotional stress, particularly anxiety, can lead to 肝郁, meaning it's a liver qi stagnant there. Okay, stagnation there. So the stagnation affect the spleen, creating a domino effect on our overall well-being. So spleen weakness and phlegm dampness constitution. So as liver qi stagnant, okay, it can weaken the spleen, resulting in a so-called 脾虚, okay, in Chinese, or weakened spleen. So a weakened spleen contribute to a phlegm dampness constitution known as 痰湿, okay, in Chinese. When phlegm dampness accumulate in the body, it can cause stagnation, leading to the formation of lump. This is in TCM understanding and perspective. So in particular, when phlegm dampness accumulate, okay, in the neck, it can manifest as lump in the neck and even bulging eyes. Yeah. So this underscore the intricate connections between our emotional well-being and physical symptom. So liver, kidney, ink weakness, and hand trembling. Okay. So the next one. So furthermore, the liver qi stagnation can extend its influence to the liver, kidney, ink weakness, contributing to trembling hand. It highlights the holistic perspective with TCM considering the interconnection of our organ and emotions. Yeah. So next. Yeah. So now we understand the TCM perspective on hyperthyroidism. Let's explore some practical remedies within traditional TCM to restore balance to the thyroid gland. So to improve the condition of the liver stagnation, okay, TCM recommend cultivating positive thinking and engaging in relaxing mind activity. Stress management techniques such as meditation, deep breathing exercise, and mindfulness can be a powerful tool in calming the mind and promoting emotional well-being. Yeah. Another key aspect of TCM remedy involve improve the function of the spleen and stomach. Okay, 脾胃 in Chinese. So this help to reduce the formation of lump associated with phlegm dampness constitution. So dietary adjustment, including the incorporation of spleen-friendly food and herbal remedies, play a crucial role in supporting the digestive system. Yeah. So TCM treatment focuses on balancing the function of the 五脏六腑 of a 5 zhang and 6 fu organs. So these organs represent different aspects of our internal system. And when their functions are harmonized, the body can actually return to a state of equilibrium, meaning balance. Yeah. So the holistic approach is essential in restoring the normal function of the thyroid gland. So the ultimate goal of TCM is achieving balance in the body energy flow, allowing the so-called 五脏六腑 5 zhang and 6 fu organs, okay, to function harmoniously. Okay, when the balance is attained, the thyroid gland, being an integral part of the body, okay, can return to its normal function, normal state. Yeah. So in summary, traditional TCM offer a holistic approach to healing by addressing the root causes, cultivating positive habits, and harmonizing body energy flow. So TCM empower individuals to take an active role in their well-being. Okay. Yeah. So next. Oh, next we will look at how this tiny little fungus, which is called Ganoderma, that being used for food supplement can help us. So it has been recognized as a medicinal mushroom for over 2,000 years. So, and its powerful effect have been documented in two of the oldest medical books in ancient China, 神农本草经 and 本草纲目. So in the last 50 years of modern scientific research in Lingzi, okay, we can find many evidence, okay, evidence-based report published. Okay, we use Lingzi and Ganoderma interchangeably. Yeah, so so we can get we can easily get more than 1,000 research results on the internet using keyword search of Lingzi or Ganoderma and diseases. That will actually show you all the research paper published, and almost all the report can be found in PubMed website, which is the US National Library of Medicine. Yeah. Okay. So when it comes to selecting 灵芝 product, you will be spoiled for choice in the market. So why would you choose product from Shuanghu? First, Shuanghu is one of the world leader in producing top quality 灵芝. Okay, their main core business is in researching, producing, and marketing 灵芝. Okay, the company has been in the business for more than 30 years, specialized in producing top graded 灵芝 product. Head office in Taiwan and named as Double Crane. In the Southeast region, it's named as Shuanghu. The company owns their in-house R&D, 灵芝 farm, as well as distribution network. So through many years of research effort, okay, with its patented extraction process, all 灵芝 products are extracted with two unique components, terpenoid and micromolecule polysaccharide content. And the product has been scientifically certified with various endorsements, yeah, TQF, HALA certified as well as the ISO, yeah. Next. Yeah. So Ganoderma and Thyroid health. Now we're talking about this so-called 灵芝's function and benefit. So first one is a regulate immune system. So 灵芝 help control and prevent inflammation by regulating the immune system. So this is crucial in preventing thyroiditis and swelling or inflammation of a thyroid gland. Yeah. So by extending, next is the prevent thyroiditis. So by exerting anti-inflammatory effect, 灵芝 contribute to the prevention of thyroiditis, safeguarding the health of the thyroid gland. Yeah. So balancing, okay, the overall balance of our overall body hormone. So 灵芝 play a role in balancing the hormone throughout the body by contributing to the overall well-being of the endocrine system. So prevent autoimmune disorder, thyroid disorder. So autoimmune disorders which are responsible for 80% of hyperthyroidism, such as Graves' disease, can be mitigated by so-called this 灵芝. So its immune regulating property prevent the immune system from mistakenly attack the thyroid. Next, we look at the blood circulation. So 灵芝 enhance blood circulation, promoting the smooth flow of blood, and in TCM perspective, qi. Okay, yeah. So this can help prevent the formation of lung in the thyroid. So in TCM perspective, yeah. So smooth flow of blood and qi is considered vital for preventing formation of lung and nodule. So 灵芝 influence on blood circulation align with TCM principle of maintaining thyroid health. Yeah. So next one is the mitigate heart problem associated, okay, with hyperthyroidism. So hyperthyroidism can strain the heart. By improving blood circulation, 灵芝 actually lessen the burden on the heart. It potentially preventing heart problem associated with this hyperthyroidism. Yeah. So in summary, 灵芝's multifaceted benefit include immune regulation, anti-inflammatory property, hormone balance, and improved blood circulation. Yeah. So next. Okay, now we talk about the The third so-called function and benefit. Enhance liver function. So linked to enhance liver function, supporting the detoxification process. The healthy liver is crucial for creating an immune system that is effectively fight against inflammation. Yeah. So healthy liver create immune system against inflammation. Okay. Remove free radical and antioxidant. So linker act as an antioxidant, reducing the presence of free radical in the body. So free radical can cause damage to DNA, and by mitigating their impact, linker support cellular health. Yeah. So free radical are unstable molecule that can damage cell. So linker antioxidant property help reduce the level of free radical in the body, so protecting cellular structure from oxidative stress. So in summary, liver function enhancement. So linker ability to enhance liver function contribute to the detoxification process. Antioxidant property. Okay, linker's role as an antioxidant significant in reducing free radical in the body. Yeah. So next. So next, we will look at the clinical research. Okay, Ganoderma. Okay, we use linker and Ganoderma interchangeability in this presentation. So Ganoderma and Graves' disease. So let's dive into the specific of groundbreaking clinical study. So centering around the potential synergy of Ganoderma. Okay, so in this so-called this research and finding, they are using the so-called they are so-called 72 Graves' disease patient. So involve 72 patients, and they are diagnosed with Graves' disease. So to ensure the robust evaluation, participants were evenly split into two groups. Okay, 36 on one side, the Ganoderma group, and 36 on control group. Yeah. So the Ganoderma group, okay, participant, what they do is that the Ganoderma group, they actually receive combinations of the so-called the drug MMT. Just now we mentioned about the metamazole, okay, this drug, and 3 capsules of Ganoderma. Okay, so the treatment is this, each containing 0.27 gram. Okay, so they let the patient take 3 times daily. So the other control group, they just take the standard treatment of metamazole, okay, MMT alone without the Ganoderma. Okay, so they actually give them the experiment span about 6 months. Okay, continue for this same dosage. Okay, allowing for a comprehensive assessment for long-term effect and efficacy of to see the efficacy of Ganoderma and MT. That's why it takes 6 months. So so the participant in the so-called the Ganoderma group follow a strict regimen of the so-called using the drug in conjunction with the 3 daily dosage. Yeah. So observation, okay, monitor they throughout the 6-month period. Participant health parameter including thyroid function, autoimmune marker, and overall so-called well-being closely monitor. So they do a regular assessment and checkup conducted. Yeah. So now that we have outlined the so-called the approach taken in the research, we'll look at the finding and the implication, the result in the next page. Yeah. So the result came back is that the so-called the Ganoderma group, okay, it showed 33 patients had improvement, okay, and improvement there because then the non-improvement they have 3. So it's about 91.7%. As for the control group, which is taking the medication alone without the Ganoderma, it showed about 27 patients had improvement. Non-improvement, there are 9 patients, so it's about 75%. So this statistically significant higher improvement, okay, in the so-called Ganoderma group, okay, suggests that a potential shift in the treatment paradigm for grave disease. So the blood test, they check on the blood test itself, they find that the Ganoderma group, okay, in terms of the TT3, TT4, and all those THS synthesis, the emphasize, they have positive impact, okay, as compared to the so-called control group. So control group, but another thing is that the control group, other than this, the control group patient having 1 case of a lower blood count and 2 cases of liver function dysfunction. Yeah, so this is not seen, not happening in the so-called Ganoderma group. Okay, so it suggests that the Ganoderma, okay, has the potential to mitigate adverse effects associated with this so-called metamazole treatment. Yeah, so with this experiment, they actually suggest that this combination of therapy, Ganoderma with the so-called medication, may offer a safer and more well-tolerated alternative for grave disease patients. Yeah, so this is based on the so-called clinical study. Yeah, next. So next research is explore the potential synergy between Ganoderma, okay, and the treatment of grave disease. Okay, just now we have talked about that. So we continue our journey on the next exploration. So sometimes grave disease makes the immune system attack the muscle and other tissue around the eyes. So this causes swelling behind eye socket, which make the eyes bulge out. Yeah. So as a quick recap, grave disease is a prevalent autoimmune related thyroid dysfunction. So accounting for substantial 85% of hyperthyroidism diagnosis. So the primary drug, okay, conventionally used for treating grave disease is just now mentioned metamazole, MMT. However, it is crucial to note that while MMT is effective in many cases, it falls short when it comes to addressing autoimmune related cases. Additionally, it has been associated with the side effects such as lower white blood count and liver function. Yeah, so conclusion, a better combination. So primarily findings suggest that just now based on that so-called control group and a Ganoderma group experiment, yeah, that the combination of Ganoderma and MMT could be a more effective and well-rounded solution for grave disease, especially when an autoimmune component is a significant factor. Okay, moreover, it showed a promise in their safeguarding liver function, addressing a key concern associated with just using the MMT. Yeah. So, so if further research confirmed that this positive outcome, it could pave the way for more tailored and holistic approach to treating grave disease, providing relief to individual gripping with this so-called autoimmune thyroid disorder. Yeah. So, next. Next, we look at the so-called supplement from Shanghai, Yongkin, Poland. So this is the most complete food on earth. They have more than 200 plus nutrients. What they have is that this is designed to help balance nutritional deficiency, provide a comprehensive area of vitamin, mineral, amino acid, and enzyme. So the product is suggested to have calming property, okay, potentially aiding in stress relief and promoting overall well-being. Yeah, the supplement also may contribute to the weight loss effort, possibly through its nutrient-rich composition and impact on metabolic process. So with a combination of essential nutrients, this product aims to enhance stamina and reduce fatigue and supporting overall energy level. The presence of various nutrients, including vitamin and mineral, from this product suggests that a potential role in fortifying the immune system, aiding in the body's defense against illnesses. So this pollen is suggested to enhance the absorption of Ganoderma, potentially maximizing the effect of Ganoderma consumption. So in TCM principle, the yellow color of bee pollen align with traditional principle, where yellow food are believed to be beneficial for spleen function. So yeah. So in summary, this bee pollen from Taiwan is a nutrition-rich supplement that offers a broad spectrum of vitamin, mineral, amino acid, nucleic acid, and enzyme. So it aims to address nutritional imbalance, support stress reduction, in weight loss, boost stamina, fortify immune system, and enhance the absorption of Ganoderma. Yep. So next. Next, we talk about fiber, also from Shangho. So this is a comprehensive fiber supplement. The key feature is a soluble, non-soluble fiber. So the supplement includes both types of fiber addressing various digestive needs. So benefit for this hypothyroidism is that individuals with hypothyroidism are advised to consume more fiber for weight control and to prevent constipation. Yeah. So water-soluble fiber. So this soluble fiber component aid bulk to the diet, inducing a feeling of fullness faster. So potentially aiding in weight management. Yeah. So by contributing to a sense of fullness, the soluble fiber may assist in maintaining and reducing body weight. Okay. The water non-soluble fiber. The non-soluble fiber speed up the passage of food through the digestive system, promoting digestive efficiency. So this type of fiber help facilitate regular bowel movement, promoting digestive regularly. Yeah, and non-soluble fiber add bulk to stool, contributing to a healthy and regular bowel movement. Yeah, so by encouraging the peristaltic movement, the fiber alleviate constipation, promoting smoother and more regular bowel function. Yeah. So next. So for dosage, next we'll look at the dosage. The recommended so-called Ganoderma dosage is tailored for health goal. First, the prevention dosage is 4 to 8 capsules. So for general preventive health, a daily intake of 4 to 8 capsule is recommended. Yeah, this dosage is designed to support overall wellness and potentially prevent health issue. Okay, so next is the therapeutic. Okay, those with thyroid disorder. In cases related to thyroid disorder, a therapeutic dosage of 12 capsules and above is suggested. So this higher intake aim to provide additional support to individual managing the thyroid condition. So the last one is the mega dose therapeutic effect for therapeutic effect. So for therapeutic mega dose, particularly when heart-related complications are a concern, yeah, and dosage of 30 or more Yonkin Ganoderma is recommended. The higher intake is standard to address specific and may require careful consideration. Yeah. So this Ganoderma do not have is actually quite safe. It's actually safe. Okay, there's no dosage issue. So you can check with the upline for the recommended dosage. Yeah. So next, talk about the testimonial. So these are testimonial from Taiwan. So um, back in 2004, Madam Sim, okay, encountered a critical episode. Okay, this is a testimony from Taiwan back in. So back in 2004, Madam Sim encountered a critical episode where her heart rate skyrocketing to a staggering 200 beats per minute. Yeah, a hospital visit, okay, revealed not only an alarming T3 level, a hormone T3 level of 600, but also there's a 1 cm goiter. Yeah, so her treatment journey is that undeterred by the severity of condition, Madam Sim embarked on a journey that include high dosage of concentrated 磷脂 equivalent to YK2 lah, okay, in addition to a so-called doctor prescribed medication. So amazingly, her T3 thyroid hormone dropped, okay, to 240 from the high of 600. So with the help of 磷脂. So this was a crucial improvement in so-called health journey. So the doctor attributed the trigger to her stress, okay, particularly due to Madam Sim at that time being engaged in the so-called postgraduate university courses. Yeah. So, however, the road to recovery was not without challenge. The prescribed thyroid medication that she was taking, okay, although it's effective, but came with an unexpected so-called consequence and side effect. So Madam Sim found that herself falling ill easily, okay, and upon investigation, it was discovered that the medication she took had led to a drop in her white blood count to a low level of 3,002. Okay, normal range is about 4,005 to 11,000. Yeah. So for that, because of that side effect from the so-called medication, she stopped the medication and continued to taking 磷脂. Yeah. So the choice was important, helping not only with the thyroid but problem, but also in getting back her overall health. Okay, she continued to take the so-called 磷脂. Madam Sim testimonial stand as a testimonial to potential benefit of 磷脂, not only in addressing specific health concern, but also in providing a holistic approach to wellness. So yeah. So next. Okay, now let's hear about the Madam Wu, okay, from Taiwan also, who is at the age of 47 back in 2004, faced a tough situation with a growing goiter. Yeah. So Madam Wu had other health issues like polio. Since young, she had polio, anemia, vision problem, and a heart valve problem. So making things quite complicated. Yeah. So doctors said that there was a 80% chance the goiter was not harmful during that time, but the surgery might be needed. Okay, and she could be on medication for a long time. Okay, once you go for surgery, you need to go for a long for the medication for a long time. So stress from her work was making her health worse. So adding another layer to her challenge. So instead of surgery, Madam Wu chose to take 30 to 60 磷脂 capsule daily for 6 months to improve her health and deal with the goiter. So at this time, the goiter was not visible anymore. Okay, this is a positive outcome, showing that 磷脂 make a positive difference in managing her condition. So despite her health challenge, Madam Wu kept living a busy life, okay, without still continue taking into working, busy life, working during the day and study at night. Yeah, so she's a very hardworking lady. So conclusion is that Madam Wu's story show that the Linzi does help with the goiter issue and other health problem. Next. So this is the last testimonial. Our final testimonial take us into the journey of Miss Ho, who faced the challenge of goiter and transforming from hyperthyroidism to hypothyroidism. So Miss Ho, at the age of 27, turned to Linzi after a goiter removal operation to ease the side effect of her medication. So she started with the hyperthyroidism, a condition where medication alone couldn't control the situation. So the goiter grew bigger, too big, causing trouble with the trachea or windpipe, leading to the need for a removal operation. So after the operation, Miss Howe had to take thyroid hormone medication for long term. Okay, so encountering the side effect. So she experienced side effects like low energy, dizziness, foot joint pain, insomnia, and constipation, which make her daily life challenging. Yeah. So she decided to consume 20 capsules of YK1 into daily, aiming to reduce the side effect caused by her medication. So remarkably, the Linzer intervention led to a significant reduction in the side effect of her medication, so improving her health and overall well-being. So in conclusion is that the Ms. Ho testimony highlight how Linzer play a vital role in managing the side effect after the goiter removal, showcase the potential of holistic support in the overall health challenge. Yeah. So with that, I thank you everyone. With that, I end my presentation.